Hello and welcome to Seek in Harmony. This video is about how I get diagnosed with ADHD. So I know that I'm very privileged. I'm very grateful that I get help. In Finland we have good public health care and I hope everybody could have good access to healthcare, but that's just not the case. And even in Finland we have some problems, but I'm very happy that I get help. So how the process went originally. I struggled with anxiety when I was 16, so I went to student healthcare to ask some help with that. I was there 1 year and then I went to therapy because I had many problems with anxiety and that kind of stuff. Second year of the therapy, I was 19 or 18. The therapist was bringing up the thing that I might have ADHD, and we did some questionnaire, and after that questionnaire she recommended me to go to psychiatry who was specialized with neurodiversity. So I went and we did some tests and we talked about my life from childhood to now, to present, and she said that I had very obvious ADHD and so I get diagnosed there. I scored with the test 10 out of 10 with inattentiveness, hyperactivity and impulsivity. Yay! They recommended me to try medication and I tried. And it helped me, and it was kind of a proof for me that yes, I have ADHD. Medication doesn't help all the people with ADHD, but some of them it helps. But if person who is neurotypical takes ADHD medication, they get hyperactive because it's a stimulant. But for me and for many other ADHD people, those medications make them calm, able to focus. I felt stable, I felt like clarity. First time in my life, and I was thinking that those people, most of the people or neurotypical people feel this way, experience world this way in their day life, and it was very mind-blowing because finally I get peace and I could stay still and focus and stuff like that. But with the first medication, because of dose, I don't know if it was right and stuff like that, I get negative side effects. When it was rebound, when the medication left out of my body, I started to shake and I get panic attack. So I quit it, but 2 years after that, before I started university, I decided to try again, and currently I have medication that works for me and I don't have negative side effects, so I'm very grateful with that. It helps me to go through my studies and daily life without me causing chaos or living through mess. My life is organized. I'm happy about it. I was questioning my ADHD diagnosis since the beginning, and even when the medication worked, I was still questioning my diagnosis. That was because I had very negative stereotypical image of ADHD people in my head, because I thought that all the ADHD people are bullies. Thanks to my past experiences, maybe I will talk about it later, I don't know. But yeah, and I was thinking, I'm not breaking stuff, I'm not being violent, how can I have ADHD? But then I learned, I get more information and I realized that my view of ADHD wasn't very correct, it wasn't accurate. So, and the second thing was that I had always struggled with certain things that are explained with ADHD, and I thought inside my head that all the people are struggling as much as me with organization, with staying quiet, with waiting and those kind of stuff. I just thought that there is something wrong with me. So when I get diagnosis, I didn't blame myself anymore of those things. I never use ADHD diagnosis as excuse for my mistakes or anything like that, but I sometimes bring it up to explain the way I am. Despite of having ADHD, I try my best to survive life as well as I can. I try certain tools and techniques and that kind of stuff. And I think that after ADHD it's very good idea to seek as much factual knowledge as you can and try different try to some like prohibition, yeah, I think, like try different techniques. And I think that this was all for this time, and I hope that you learned something about this, or I hope that this works as peer support or something like that. And like, subscribe, and follow. Like, subscribe, and comment if you feel like it. And until next time, bye bye.